Good morning. Today on Spotlight, we'll take you inside a new national survey that dissects opinions about America's public health system. Why do an increasing number of Americans give it a positive rating and support substantial increases in federal health funding? We'll ask nationally respected health expert Dr. Donald Schwartz, Senior Vice President of Programs at the Robert Wood Johnson Foundation based in Princeton, New Jersey. And later on our Sunday morning program, Dr. James D. Grant, Senior Vice President and Chief Medical Officer of Blue Cross Blue Shield of Michigan. He'll tell us how one of the largest and best known health insurance companies is responding to the COVID-19 pandemic. It's Sunday, May the 16th. I'm Chuck Stokes, and this is Spotlight. A brand new survey from the Robert Wood Johnson Foundation in partnership with Harvard University. And the gist of it seems to be that the public confidence in public health is growing considerably from what it was a few years ago, correct?
Well, in some ways, yes, in some ways, no. So the public support for public health has grown. Mm-hmm. 3/4 of folks are supportive of more funding for the public health system, but their satisfaction with the system has gone down since the H1N1 epidemic.
All right, let's take it one at a time. Why do you think, in terms of satisfaction, why do you think that has been growing? Because of the pandemic?
Well, I think the pandemic has tested out the system. What we know is that since H1N1, the flu epidemic in 2009, our support for the public health system, our dollars and cents support for the public health system, has generally either been the same or gone down. In Michigan, for instance, the amount that's spent per person on the public health system has actually gone down since 2009. So we see that the real dollar support for the public health system has gone down, but people's understanding of the system and their feeling of the value of the system has gone up. So we have a funny mismatch.
Absolutely. Talk a little bit about trust as well, because in looking at the survey, I also saw that people have a tremendous amount of trust in the actual professional healthcare workers, but they don't necessarily trust government, whether it's big government in Washington, D.C., or it's their local health departments. Are you sort of miffed by that?
I don't know that I'm miffed by it. I am not surprised given what's happened in the last year. We've had a year when the system has been tested, and what we've seen is that the system has responded, but generally as the enforcer, right? It's been the public health system that has said we need to wear masks and be socially distanced. All those important messages that many of us have found not so pleasant. Now that there's vaccine and the system can help people not get COVID by doing something affirmative and visible, I imagine that people's feeling about the system is going to improve. What happens with doctors and nurses who have very high approval is that they're visible and they're doing things every day for people. So we're more familiar with our doctors and nurses than we are with public health people on a daily basis. We know that people support and have more confidence in their local public health department and their state public health department and than they do with our national. And I think what folks have to do is step back and realize that we use public health daily. Public health keeps our food safe. Public health keeps, in general, many infections away from us. Salmonella and E. coli and other kinds of infections. Public health helps keep our air clean and our water clean. It helps keep all of us safe. All of those things happen in the background. The pandemic has been in the foreground. We've all seen COVID and the impacts of COVID. And as we've seen those impacts, people have begun to question how adequate our public health system is. to have a better system, we're going to have to spend a little bit more to support the system.
Is it your hope that when people see this survey, when lawmakers see this survey, that they will take this and use this to be able to convince their various legislatures or city councils or whatever the particular governing body is and say, okay, we have to put more money into the system in order to be able to keep our system safe and to possibly avoid another pandemic coming down the line in the future?
Absolutely. I think you've got it exactly right. We all need to be saying this is an important part of our country, and the public health system needs to be strong in order for all of us to be both strong and safe.
Doctor, you have a rich history in medicine, also in terms of policy making. You were in Philadelphia as the major health commissioner there for a number of years. Do you feel confident that if enough money, more money than what we're putting in now, goes into public health, that we will be in a position to be able to stop another pandemic from coming down the line? Or is that just something that no matter how much money we throw at it, we can't see those type of things coming?
We can do so much better in terms of fighting disease and pandemics if our public health system is strong. And we know that. Other nations know that as well. We need to be prepared. We are a country that has prided ourselves on being prepared over time. And what the pandemic has shown us is that we have so underfunded our public health system that we have gotten to a point where we are not adequately prepared. We need to do something about that.
Dr. Schwartz, we need to take a real quick break here. We'll hurry right back and we'll talk to you about the safety involved with children getting vaccinated. We'll be right back. We are doing a pretty good job in terms of getting vaccines into people, especially compared to where we were just a few months ago, and particularly from where we were last year. But as more and more vaccines become available and we can get them, whether it's to people in the large urban areas or in the more rural parts of our country, that the demand for vaccinations seems to be going down.
Well, it's a personal choice whether to get the vaccine, but it has impacts on our whole public. So I hope people will feel responsible enough to recognize they have to listen to science. They have to realize that the work that's been done to create these vaccines has been going on for decades. We know that they're safe. We know that they're safe enough for our adolescents as well as for adults. And each individual has a responsibility to get immunized to protect all the rest of us.
The CDC and the FDA have taken some public relations hit throughout this whole pandemic process. What do we need to do to be able to build that confidence up again within the public so that they totally trust these organizations? So much of this has become politicized.
Yes, I think we need to tell more stories about all the good, in fact, wonderful things that those agencies do for us. This is one pandemic with one organism. There have been many different germs that have not led to a pandemic and have not led to this much death because the system has worked so well.
You're one of the nation's foremost experts in pediatric medicine. It was certainly your expertise. We're now talking about trying to get vaccines into kids between 12 and 15. Certainly, Pfizer has just gotten this approval to be able to do that. For that person that is sitting at home wondering whether or not it is safe for their child to be able to have this vaccine, what's your message to them, and how do we encourage as well as convince them that this is a necessary part of the process if we are going to get the country as a whole back on its right feet?
So when I was in practice, parents often asked me, would you give this to your kids or would you give this to your grandmother? And the answer to that is absolutely. And we've given it to all our grandmothers. This vaccine is safe. We have given it to people throughout the country and the world. More than 150 million people have gotten this vaccine, and they're doing well. You get a sore arm, you may get some fever, you may not feel well for a couple days, and you are then protected and you protect others. And for adolescents, it means they can socialize, they can go back to school, they can play athletics, they can do all of the normal things that it's so important for teenagers to do if they're immunized. It is really important for people to look at the facts and recognize that just like with the DPT vaccine, which we know so well, and the polio vaccine, which we know so well, that all of our children have gotten, we can safely give them the COVID vaccination.
What message would you send to women who are either pregnant or thinking about becoming pregnant? Is it safe for them to get this vaccine?
Yeah, so the recommendations from the Centers for Disease Control is that pregnant women, particularly in their last trimester, get the vaccine. And that's because of what happens if you get COVID itself during pregnancy. We know that pregnant women are at risk of COVID. And the idea is, which is worse, getting COVID or the vaccine? And the vaccine seems safe, particularly in the third trimester. So I encourage women to talk to their obstetricians to get good information and get immunized.
And finally, what's your best guess for vaccinating kids under 12 years of age? How long will it take America to get to that?
Well, the trials are going on now, so I'm optimistic that we'll get there before September, but we want to wait and see. We need to see the science. We need to make sure before we recommend anything that it has been tried and it is safe, and then we can use the vaccine if it's safe in children.
All right. Dr. Donald Schwartz with the Robert Wood Johnson Foundation there in Princeton, New Jersey. Thank you so much for joining us today on Spotlight. Stay safe, and we'd love to get you back in the future.
Thank you. Happy to be, and thanks for your interest.
It's certainly
Have
our
a good
pleasure.
day.
It's our pleasure to do the same. And when Spotlight returns, we'll check in with Dr. James Grant of Blue Cross Blue Shield. He is their Chief Medical Officer. We'll be right back. Stay with us. Dr. Grant, thanks for joining us today on Spotlight. Blue Cross Blue Shield, everybody knows the name here in Michigan and all across the nation. Would it be safe to say that in addressing COVID-19 that you guys have basically had to go to your war room and put out an all-assault front on it?
Oh, for sure, Chuck. We've actually, Blue Cross Blue Shield of Michigan alone has put out more than $1.5 billion behind a multifaceted response to COVID-19. And of that, about $750 million alone was just behind COVID treatment.
Right. And in terms of vaccination, where do you stand right now here in Michigan?
The three words I can leave you with is vaccinate, vaccinate, vaccinate. We're at about 55% of Michigan is vaccinated today. We got to get the number up. The vaccine's been proven to be safe. I've been vaccinated. My wife's been vaccinated. My kids have been vaccinated. My parents have been vaccinated.
Doctor, what's the hardest part of this? Is it the education in terms of the public? One, getting them to believe that the vaccine is safe, and two, believing that this is a very real pandemic?
Well, Chuck, it's actually, if you look at it, it's almost in phases. We actually, in the very beginning, our biggest problem with the vaccine was getting enough vaccine out to everybody who wanted it. We're now at the other side where we have plenty of supply, but now we're at the point where we're having to convince and talk to people and educate them about the importance of getting the vaccine. So we've done a total flip, and the vaccine first was approved in December. This is May. We've done a total flip, and we've got to get the rest of the state vaccinated. We've always had, regardless of the vaccination, and we've had ups and downs. We've always had to have educational processes. We've had to talk with the community about the benefits of vaccination. So that part is normal, but this one is a vaccination that's hitting. It's not a childhood vaccine. It's not a senior's vaccine. It's a vaccine that's hitting the whole population. So it's something we've never dealt with on this scale before.
What's been the best way of going about educating the public? Blue Cross Blue Shield is everywhere. You're in the urban areas, you're in the rural areas, you're from the UP on down. What has been your best ally in terms of partnering with community organizations to get the word out?
Chuck, it's been everybody. It's been someone like you having us on the show today. It's been billboards. We've sent out millions of postcards to Blue Cross Blue Shield members. We've actually gone into the communities. We've had, I can't tell you how many specific outreaches with churches, with local groups, with you name it. We've actually been out there in the trenches, getting people to understand that the vaccine is the only way we're going to beat this.
And I know what you're hearing from your members, but what are you hearing from the providers? What is it they need most from a large insurance company such as yours right now?
Well, what they need most is, one, we need to help some of the providers to get the vaccine, those that are getting the vaccine to give the vaccine. What we're doing the most is actually we're covering the cost of the vaccine. Between the federal government pays for the vaccine, we pay for the administration of the vaccine. Nobody, absolutely nobody, should receive a bill for getting the vaccine.
And what about, you've got investors involved in this, and let's face it, you are a company that you've got to do business. You've got to pay your bills as well, and you got to make sure that you're a viable company. How much has COVID-19 wreaked havoc in terms of the bottom line for Blue Cross Blue Shield?
Well, Chuck, it's an interesting question. Yeah, like I said before, we've put $1.5 billion into COVID. On the other hand, though, some of our expenses have actually diminished because people are delaying care. That's not a good thing. And what we've actually done is we've taken some of that money and we've actually been able to return it to our customers and to return it to our members in the forms of various deductions in premiums and rebates and things like that.
So you've had to be super creative and think basically out of the box.
That's what we've been doing every step of the way.
All right, we need to take a real quick break. We'll come right back. I want to try to get your opinion on what we're now getting a lot of attention to, and that is making sure that our young folks get vaccinated. We'll be right back. Stay with us. Doctor, we're now hearing about 12 to 15-year-olds can get vaccinated. How do you get a message to young people who, let's face it, when I was that age, I thought I was invincible, and I think most people that age think they're invincible. How do you make them think they aren't?
Basically, we have to get the word out that we've seen 12 to 15-year-olds get sick with COVID. We've seen 12 to 15-year-olds throughout the country die from COVID. We got get the message out directly to the 12 to 15-year-olds. We've got to get it into the schools, get it to the teachers, and get it to the parents.
And are you getting resistance on a large scale from parents who just say, you know what, that's my child? And if there's one thing that we're all concerned about, it's that next generation, and you want to make sure that you aren't doing anything at all that is potentially unsafe for them.
Well, Chuck, it's really too early to tell right now. As you know, the vaccine was just approved last week for 12 and older. So we have the jury's still out on that. And like I said, it's one of those things we got to get to the parents. Got to get to the parents to get to the kids. A lot of kids are seeing what's going on and they're wanting it. A lot of them are going to listen to their parents, to their teachers. They're going to hear the media. It's a very different world now. There's lots of information out there for everyone to see.
Talk to me about the pros and cons of the shift to telehealth, because you've had to do it. We've all had to make, all sorts of adjustments. Even in our business, we've become a lot more virtual now. Is that better or worse for healthcare in general?
Well, Chuck, in general, it's better for healthcare because what it's doing is it's giving so much more access to so many more people. We at Blue Cross actually put $5 million and gave them to our physician groups to support telehealth implementations at the beginning of the pandemic through what we call our physician group incentive program. The other things that we've done is we've actually relaxed a lot of the diagnosis and treatment codes that we need to ensure that patients had telehealth opportunities. And the one area, Chuck, we've really seen tremendous progress, the pandemic's done a lot of things to us, and behavioral health is one of them. And as more and more people are having behavioral health issues. It's a quick way and it's a convenient way of having people stay in their house, not worry about being exposed to COVID, get on the computer and actually have a good session with a behavioral health provider.
They oftentimes say hindsight is 20/20. What have you learned that perhaps has become positive about this pandemic, if indeed anything can be considered positive coming out of this pandemic? Knowing what you know now, if you look back and you knew the pandemic was coming, what would you perhaps do different?
We'd probably start sooner. I mean, if you remember, I'm just thinking today, a year ago, we were at the point where we were washing doorknobs and washing our cereal boxes and that kind of stuff. We've learned that that's not really an agent that's going to disperse COVID. What we've learned is really, we've seen the importance of masking. We've seen the importance of social distancing. At Blue Cross Blue Shield and throughout the country, every year in the fall, so many of us get flu shots. We're seeing very, very low incidence of the plain old flu this year. And that's because of the masking and the social distancing. That's one thing that we've actually learned, and we'll probably take it away once we get through this crisis.
Sure. If there's one thing, and this will be the final question, if there's one thing that this pandemic has absolutely exposed, it has been the inequities in healthcare, whether it's rural areas or it's very the urban areas or it's people of color. How do we address that so that we learn from this and we make improvements so that 5 years from now, we aren't in the same position we're in now?
Well, Chuck, you bring up a great point, and it's something we're very focused on now, is we've really seen what we call healthcare disparities in communities of color, and we've seen how we have to have an intense focus on taking care of yourself, on and treating yourself, and the importance of health maintenance. And we've actually seen differentiations in degrees of hypertension and coronary disease and diabetes disease in various communities, whether it's rural, whether it's communities of color, whether it's urban, various parts of the state. We've learned vaccination education. If you look at our numbers, our numbers are very different in one community versus another community. And these are the things that we've got to figure out. How do we improve the health of our population?
All right, Dr. James Grant, Senior Vice President and Chief Medical Officer with Blue Cross Blue Shield of Michigan. Thanks so much for checking in with us. We will stay in touch. We haven't gotten all the way through this, but we're doing a lot better than we were a year ago. Thanks so much.
Thanks, Chuck. Thank you.
All right, our pleasure. And I'm Chuck Stokes. We'll be back next week with more newsmakers in the spotlight. We hope you have a great week.